with Robert Welch, who's Director Welch of the National Center for Cannabis Research and Education Research, Associate Professor, School of Pharmacy, Research Institute, Pharmaceutical Sciences at the University of Mississippi. And if I read the rest of this, our time will be out. So it's... How you doing, sir? It's good to have you.
I'm doing great. Thank you so much. It's nice to be here. I appreciate it.
Thank you, man. I appreciate it very much. Excuse the voice. I need to take liberty here, a personal point of privilege here. There was one thing from yesterday, and we did a lot on D-Day. Yeah. And I found this one, and I wish I had it for yesterday. You and I probably, I know I do remember Andy Rooney.
Oh, yeah.
He was on TV for a long time. And Andy had a cut that went viral. And I just want to play the first 38 seconds of it because a lot of people my age and younger, certainly younger, don't understand the value of what these people did. And he puts it in 38 seconds and does such a wonderful job. I had to play this. Here it goes.
Because it was part of my life, I'd like to say something about D-Day. If you are young and not really clear what D-Day was, let me tell you, it was a day unlike any other. There have only been a handful of days since the beginning of time on which the direction the world was taking has been changed for the better in one 24-hour period by an act of man. June 6, 1944 was one of them. What the Americans, the British, and the Canadians were trying to do was get back a whole continent that had been taken from its rightful owners by Adolf Hitler's German army. It was one of the most monumentally unselfish things one group of people ever did for another.
That's it. That's it right now. And as an adult, I can understand some teenager not understanding that and sloughing it off. But as an adult, you have a responsibility to understand what these incredibly brave heroes did for not only this country, but for the world. And you go back and you ask that question, where would we be today if that failed and Adolf Hitler was victorious?
Yes,
so.
Sir.
All right, let's get into this. By the way, there was a lot of things that happened during the legislative session. There was Senate Bill 2888, which kind of regrouped and put more importance on what you guys do. Can you explain that a little bit?
Oh, yeah, that's a great question. And by the way, thank you for introducing this segment with that clip. I actually saw that whole clip last night.
Oh, did you?
Yes, sir. And both of my grandfathers fought in World War II, so it's a very important thing to remember. So thank you for doing that. Yeah. But I have to give a lot of credit to Senator Blackwell and his colleagues and others that helped push this bill forward, and Governor Reeves, who signed the bill ultimately. And so what we're going to be trying to do from my center, the National Center for Cannabis Research and Education, is working with the Department of Health closely with the new, still pretty new, the Mississippi Medical Cannabis Program, and we're going to focus on research because we feel that if we're going to call these products medical, we need to do the proper research that elucidates some of those ideas that we think are true, but how is it really impacting the patients? Now we have I think about 40,000 Mississippians who have certifications for medical cannabis. How can we look at their outcomes from a standpoint of, are these products working for these conditions? Are there safety issues that we need to know about? And so we can help gather a lot of information from the pursuant to this bill that will help with this and help. Ultimately, the goal is to help better the program and help patients in the end.
Robert, are there any other pharmaceuticals that the FDA has looked into and researched over the years that are available behind the counter and that originated in plant-based?
Yes, actually there are.
That's not that unusual, is it?
No, and as a matter of fact, okay, so if you think about plant-based cannabinoid products, the only one that was approved was called Epidiolex, and what that basically is CBD oral solution for patients who have very severe epilepsy syndromes, rare conditions they're having thousands of seizures a month sometimes. And so we know that CBD or cannabidiol is the most predominant non-intoxicating cannabinoid found in the plant, and we know that it is a very powerful anticonvulsant.
But no THC then.
Well, okay, so with any plant-derived product, you can't completely extract every single constituent in that plant out. So even with an Epidiolex product, there's a tiny trace amount of THC, but it's not clinically relevant. So,
how do you know where these? Well, because there's a lot of CBD oil being sold out there, right?
So that's a great point.
How do you know where the relief is really coming? Maybe it's coming from just trace amounts of the THC.
Well, with Epidiolex, we studied. Had several thousand patients in studies. I actually worked for the company GW Pharmaceuticals who went through all the clinical trials. And so the great thing about that product is it's a prescription product. So it has to meet certain standards every month. You know exactly what is in that product. With these other products that are called CBD oils, or all these products that are now being sold in the gas stations under the guise of hemp, some of those most of those are, number one, they're synthetic, so they're not plant derived. And so they are potentially dangerous. And we've done studies looking at impurities and byproducts that are in those products that are increasing Poison Control Center calls. The CDC has data that accidental ingestions by adolescents has skyrocketed because of these products. So with those products, you really don't know what you're getting. That's the big issue with those products.
It is Russian roulette, because some of that stuff is just certainly when you go in, you get some kids 16, 17 years old, they're just openly selling this to just about anybody that has some money in their hands or got a card that they can swipe, and they'll buy it with a couple of Red Bulls, and who knows what happens with these kids, especially if they can function in school or at work. You worry a little bit about them driving to get there.
That's true, and also, not only do you not know exactly what all is in there, they make them very, very potent. So they can increase the concentrations too. And I'll give you an example. So compare some of those products to the plant-based products that are sold through our Mississippi medical cannabis dispensaries. Some of those products in the gas stations are far more intoxicating than you will even find in a legitimate regulated dispensary, and that's because they are regulated. So there are parameters on how much THC can be in those products versus these that are being sold on this ancillary market are not being regulated, not being enforced. They're also being sold alongside things like kratom, which can be addictive, and other things. Now I've noticed they're starting to sell psychedelic mushroom products in these stores, and so it's kind of a free for all in terms of what's being sold out there. Yes.
In what form is that offered in the gas stations?
So most of the things that I have seen are available in an edible type form, so a cookie or a gummy.
No kidding.
With the psychedelic product.
Wow.
Now that's beyond the scope of my expertise, the psychedelic stuff. But the cannabinoid products are very concerning. We've seen a lot of issues with Delta 8.
So you guys went and bought some and brought it back to the Institute and just tested it.
That's correct. We gathered samples from all over the country for this particular study that was published last year.
What was some of the worst offenders?
Well, we don't really have the ability to talk about specific companies, so a lot of that was even.
How about product? Give me the product.
Okay,
Gummies
so it's really any of the products. So the vapes, cookies, gummies. You can even buy tinctures that have Delta 8, Delta 10, THCP, THCO, and they're all synthetic. So there's a lot of byproducts that come with the synthesization of those products.
Yeah, I want to ask you, it's so much more. We need a couple of hours.
Sure.
Why has kratom kind of got a pass on this?
Kratom is another issue that is a little bit out of my scope of expertise as well.
Yeah, so you haven't done a lot of study on kratom?
We at the university, we have not. We have not done a ton of work on kratom. Right.
But we got a break here. I want to come back. I want to ask you how much marijuana you guys go through.
Sure.
And what the process is over there and where you get it.
Sure.
When we return with Robert Welch, Director of National Center for Cannabis Research at Ole Miss, back with that and more. Medicine Man. Got the Medicine Man with us, Robert Welch, from the Director of the National Center for Cannabis Research and Education Research. When you look at how long you guys have been doing this, and you point to some of the successes and things that you've found out over the years, if you're looking at the top 2 or 3, what would they be, Robert?
Well, one of the big things that we have done for the federal government, for the DEA, is they send us confiscated samples of illicit cannabis. So we test those for potency. And so one of the things that we found over the years is that we have data back to the 70s, but just let's say from 1995, you had about a THC percentage potency of about 4%. Now, due to hybridization of growing, most of those substances now have at least 20% or more THC. So you have a situation where people who get illicit cannabis off the street, they're smoking a different product than they were several years ago, and so
4% to 20%.
Yes, and some of them are higher than even 20% THC. So that's a very potent product. Now, the other thing that we've been able to do over the years, due to our federal funding through the National Institutes on Drug Abuse, we've had that contract since the 1960s, 68 actually. So we provide anywhere from 25 to 40 kilograms of plant material for research purposes. And we also, that's per year, that's in 2 to 3 indoor growing cycles. So we produce about 1,000 cannabis cigarettes per year that are very specified in their content. So researchers around the country obtain products that we grow and we purify and extract into cannabis forms that they're wanting to test for research purposes.
You know the words, politics made strange bedfellows. How in the world did Mississippi end up with this at Ole Miss? Because it used to be the only one of its kind in the United States of America. Is that still true, or is there another one?
That's still true, and so
it is true, because we had heard at one point there was somebody else doing it.
Well, that's a good question, because there are 8 other DEA registrants who have competed with us now since we won this contract again last year in last May. And so we had to compete. It was very competitive. So these other DEA registrants put their hat in the ring, so to speak. And so with all of the things that they looked at and with all of our expertise and knowledge on how to produce these products, we won the contract, and that's through 2026. So that will be we'll have to compete for it again. But that's money that's designated for specific task orders that NIDA gives us, and so they trust us to provide quality products for research around the country.
Yeah, but I'm just thinking about the Democrats and the Bible Belt and everything else back in those days. The governor and the legislature and everything else was taking a look at this and said, "You people want to do what? Put a pot place at Ole Miss?"
Well, one of the key figures there, and most of the credit, I would say, goes to Dr. Mahmoud El Soli, and he was the one that was there. He's still the director of that project at the Waller Lab, and so he's very important. He's really one of the world's experts on cannabinoids and cannabis, how to grow it, how to research, how to produce a material that's research quality, because what you find out there is such variability in these products. Even within the same plant, if you look at buds, for instance, it's very difficult to do research with buds because there's variability even within the same plant in what's in those buds. So you have to purify and extract it to a point to where, hey, we feel comfortable giving this to a patient. to research.
Hey, Paul, I wanted to mention, because you were mentioning El Soli, and Mr. Welch and I were just visiting, but one of the great things, I remember when he showed me through the facility, and we were talking about it, and they originally had like suppositories that were used, and I remember him saying, yes, the suppository, not very popular. But he is a brilliant man, amazing.
He and his team are excellent. I work with them closely on things, and they're just great. And they publish a lot of important research. You know, I mentioned that study that we published last year that was talking about these Delta 8 products. So that's the kind of thing that and we also have several studies over the years looking at every single cannabinoid and what the chemical structure is, what the components of those products are, how they might affect health in patients. And so we're hoping to carry that forward and continue that in light of this bill, you know.
I want to ask you this because, and I'll do the story at the same time.
Yes.
There was breaking news yesterday from Memphis, Tennessee. Elon Musk was there, and they wondered what he was doing in Memphis. Well, he announced that the world's largest supercomputer will be located in Memphis, Tennessee. It's a multi-billion-dollar gigafactory of compute. It'll be the largest capital investment by a new-to-market company in Memphis history.
Wow.
Expected to open at the end of this calendar year. Pending approval, they're going to be putting it in it's a building that was used, I forgot what, it's somewhere in here. Here it goes. Will occupy the former manufacturing facility in Memphis, Townsend. In Memphis, I'm sorry. Townsend did not identify the specific site of the company's request. He proposed, it's a supercomputer. He said if you take the two largest supercomputers in the entire world and you combine them and then you multiply them by 4, that's what they are building in Memphis. The water and light guy, Mr. McGowan, said the company will be able to provide the XAI's utility, the needs, without putting local power and water systems at risk. And it's the former Electrolux building is where some people think that's going to go. But my question was this. Has AI changed that or enhanced it? Because putting all of that data together is tremendously important.
Well, I am not aware of yet how AI has been able to improve or integrate with any of the cannabis work in per se. I'm not sure that I'm sure there are folks that are looking at implementing AI in some aspect to further research with cannabis, but I personally am not aware of any research that's being done with AI or how it could help with all of these issues with cannabis.
Robert Welch is the director of the National Center for Cannabis Research at Ole Miss. When you think that especially with the Senate Bill 2888 and you guys putting this together, what's the status of that? Is everything in place now, or? So
that's a great question, and it's becoming more clear. So the way that and I learned a lot about how this works when I was at the Capitol a lot this last year, and so we will receive some funding on July 1, and then we can start doing our work, working closely with the Department of Health. They have a great team, the Mississippi Medical Cannabis Program, that's a sub-department of the Department of Health. The Dr. Edney is over, and then Laura Goodson and Callie Anion and others. They do a wonderful job with that program. So we're trying to complement and work closely with them on what their needs are, because, for instance, they get a lot of requests for, can you add this condition? Can you expand the uses for these products? And we can do a lot of research and literature reviews, and we have a lot of expertise in the building that has done this for years. We have many cannabis researchers at Ole Miss. You can only imagine with our history. And so we have access to some of the world's greatest and most knowledgeable people on this topic, and so we can really help, I think, elucidate for the patient and the lawmakers and healthcare providers. You know, there's a lot of questions that they still have.
Listen, I would think it'd be number one in my mind is that the physicians across the state, or any of the people, the nurse physicians, whomever's out there writing prescriptions for this, the interaction with their current medication Because I think it's going to be the number one thing when a patient comes in, and they're going to divulge us to the doctor one way or the other because they've got to write the script on this thing, to come in and say, all right, how's this going to work with my blood pressure medicine? How's this going to work with all? And if you can answer that when we come back in final segment with Robert Welch right after this.
Thank you.
Okay, let's get back with Robert Welch. Robert, limited time here, but two questions. First of all, the interaction we talked about with physicians. I would think that would be the one of the top things that they would need to know, to especially since you have such a variety or variance. It used to be 4%, now it's 20%. What they can expect, and especially with the other and pharmacies too.
Yes.
And the second question is any changes or anything, how are you guys reacting and to the Fed's decision to kind of reclassify marijuana? Yes. So first of all, let's take the interaction.
Yes, that's one of the things that we're going to be looking at through the 2888 bill. We're going to be doing drug-drug interaction studies on a lot of trying to ascertain what drugs are most complementary. We know a lot of that information already in the literature, but I think we need to do more studies on specific products and some of these newer cannabinoids that are out on the market. There's not a lot of research on those, and so that is very important, Paul. And another thing to remember is, since these products are not prescription, the only way that a physician could know if he or she is not a certifier through the program and they're a physician that's not part of the program, they would have to look at the prescription monitoring program, which monitors controlled substances. And so a patient may or may not tell their regular physician or provider, hey, I'm now on medical cannabis. So that's something that needs to be educated on as well. Yeah. Looking at the
I would imagine there's some who don't want to tell them.
Well, that's absolutely. You know, yes. and the other thing is asking the questions, are you also taking some of these products in the gas stations? Because that could be interacting with some of their drugs. Now, in terms of the rescheduling from 1 to 3, that's going to really open up research channels and make it a lot easier for folks to do research. So I believe a lot of more pharmaceutical companies are going to jump into the fray in developing these products. It's only rescheduling of the plant substance, though. So all these products that are synthetic, that are being sold under the guise of hemp, it's not going to affect those. But the DEA is still going to have its same purview as it does under Schedule 1. It's just going to be less restrictive, and there are some tax benefits for businesses who, like the medical cannabis state-run programs, they're going to potentially be allowed to take deductions from a tax standpoint.
I don't see how you do it, because it like you said, there's this variable equation to it. One of the things we learned when we first started talking about this, that if you have this product in a truck and it gets overheated or something, it changes. It's almost like if we were talking about bourbon. If you turn the air down in the liquor store, bourbon goes from 75% to 120% alcohol. But I mean, you have that to deal with too. Yeah. So how is any testing lab really that accurate at the end product when the customer finally buys it?
Well, and in our state, I think we did a good job with our testing parameters to make them fairly strict on what passes and what can be sold. And a lot of products that are sent to the testing lab are not approved to be sold in the dispensary. So, but I do see your point. There is a lot of variability that in dealing with any botanical drug substance.
Robert, what do you think this is going to be in 15 or 20 years from now?
Oh, I think it's going to be similar to Canada. What's in place in Canada, recreational. That we're going to still have, especially if it's in the scheduling. It is that we will probably have a lot more pharmaceutical products that are cannabis based, be them plant derived or synthetic. But I do think that we're going to see an explosion, and this industry, from a business standpoint, is going to grow exponentially even more. over the years. So I do think we'll get to the point to where it's completely descheduled from a standpoint of a recreational program. But even with those recreational programs, like in Canada, there's very strict limits on how much THC can be in a package and in a unit. And so with now, you can go to a gas station and buy something much more potent than you could in a Canadian recreational facility.
With the knowledge that you have, you've got to worry about these kids who are in not only high school, some of them in middle school,
yes,
with the vaping and what they're ingesting.
Oh, I am concerned, and not just from a standpoint of cannabis. The thing that's concerning there is the nicotine vaping and
yes,
and the excipients and other additives that are in those vape products. It's not necessarily just the nicotine. Of course, nicotine is addicting. That we all know that, but there are other components in those products that they may or may not tell you are in that product. So you really sometimes don't know what you're ingesting right into your lungs. So it's concerning.
You're bulletproof until you're not.
That's right.
Robert Welch, don't be a stranger. Got to get you back on.
I appreciate it.
We appreciate it very, very much. Enjoyed it. Very, very informative. Director of National Center for Cannabis Research at Ole Miss.
Thank you so much.
Got a news update. Thank you.